Welcome, everyone, to this short podcast talk on how third party backup can accelerate recovery. To ensure the NHS continues to deliver high quality care, having the always on access to data is critical. And as a result, protecting and ensuring recovery of essential data, such as patient histories and clinical data at all times in the NHS, is a must. So I'm Mark Blanchard, I'm the Public Sector Director for GovNews, and I'm delighted to be joined by two special guests here today to talk to me about this very important subject. So let me tell you a little bit about who they are. I've got David Leech. David is the data management specialist at Bytes, and David has worked in the IT channel for over 15 years, starting his career within IT distribution, looking after many established resellers and focusing on data protection, professional services, and Microsoft. Having moved to Bytes in 2022 as an enterprise technology specialist, he worked with a vast range of customers to align the best hybrid infrastructure, the best cloud, and looking at data strategies for their needs. More recently, in 2023, David took up the role of a data management specialist, narrowing his focus to an area of technology where he is most passionate, and that being on data protection and availability. So David's always keen to stay true to those values of Bytes and providing best fit and cost-effective platforms to align with customer strategies both today and in the future. David, delighted to have you with us.
Thank you, Mark. Good to be here.
Excellent. And joining David, we have Shyam Oza. Shyam is the Senior Product Marketing Manager at AvePoint, responsible for understanding the needs of the software as a service, data resilience, and management markets. Shyam brings over 14 years' experience in managing, marketing, designing, delivering, and supporting enterprise software products. Over the years, he's done everything, I believe, and I'm looking forward to hearing all about this everything, but everything from teaching video game design to transforming legacy enterprise business models to fully taking advantage of SaaS technology and agile methodologies. So, Sham, really looking forward to talking to you and great to have you with us.
Thank you so much for the time today, guys.
So, I'm not going to start with an easy question. I'm going to start with the most pertinent and relevant question straight off the bat. Okay. In a setting where many NHS organizations, the majority of NHS organizations, if not all, are relying on Microsoft 365, why would there be a need for a third-party backup solution on top of what's already provided with Microsoft? Sham.
Yeah, a lot of people might say, well, I spent so much money. I got this SLA with all of these nines at the end. Now you're telling me I need to invest in additional backup and recovery. And unfortunately, the answer is yes. Whether that's simply due to regulatory requirements, you may be required, due to 321 backup, for example, as a best practice, to create a copy that sits outside the Microsoft Trust simply to satisfy regulatory requirements, or you may have operational requirements that far exceed the native RPO and RTO that you get from Microsoft 365. If you are dealing with that urgent patient healthcare and you need to be able to recover that within a few minutes or to a fine grained individual record or version of that record, that's something that you just don't get out of the box with Microsoft 365. Those SLAs are really around availability and uptime. So, the catastrophic data center failures, the hardware failures, things that used to plague a lot of legacy workloads, those are all gone, and Microsoft's taking care of that. So you at least have that peace of mind. But for the continuity and compliance side, you still need that third party trusted partner.
Mhm. David, how do Bytes explain that to customers?
Yeah, it's very much, I suppose, the shared responsibility model for the data. So, as Shyam said, the underlying resilience of the Microsoft 365 platform is amazing, and they've created these fantastic tools that allow us to create data to service customers or provide the care that's needed. But ultimately, there is still that risk, I suppose, that data that's created is so important that you have to be able to maintain access to it. And it could be something as simple as a user, a doctor, a healthcare professional has created some patient notes somewhere, and for whatever reason they choose to leave the NHS, they go elsewhere. Um, that user's profile is kind of removed at that point, and you've only got a certain length of time while that data still remains available within the Microsoft ecosystem. So to have that third-party backup solution, such as what AvePoint can provide to maintain extra copies of the data, it keeps it available, is critical just to ensure that the service delivery is still there onto patients.
So in a healthcare environment, downtime risks patient safety. How far do third-party backup solutions address the unique challenges in the NHS, David?
Ultimately, it's ensuring that there is extra copies of the data that are taken, stored in a secure, immutable location that's outside of the Microsoft ecosystem, so that let's say if for whatever reason within the Microsoft tenant, the healthcare professionals can't access that data they need around patients to make a decision of say previous treatment, there's been previous conversations they've had with a doctor, by ensuring that they've got extra copies of the data taken by AvePoint, then it just helps to ensure that they can get it, they understand the patient's needs, and then it just relays on automatically into the decision making that they provide around that healthcare.
Shyam?
Yeah, I'd say the only thing I'd add to that is the availability of data is an important part of the story, but the accuracy of that data is also very important. So, for example, within Dynamics 365, you have records down to a field level, and somebody had a bad day, somebody was in a rush, or somebody was learning the new system. They input the wrong information into a field, or they pick something wrong from a pick list value. And this drift can occur and potentially have negative, impacts on things like patient outcomes because of these, innocent mistakes. So having solutions in place that can roll back a document to a specific version, or to be able to find differences and deltas in patient records, or metadata, or a very, very granular list item. These can be things that you discover you have a need for when it's too late, kind of in the moment. And so it's better to have a solution in place that can give you that peace of mind, whether it's items being accidentally deleted, data starting to drift out of what the truth is, and things like that. So accuracy is a big part of it too, on top of availability.
So, David, can you talk us through what shared tenant, local tenant organizations need to consider when it comes to backup?
Yeah, ultimately at a baseline, it's the same consideration, in that ultimately the data, the primary data, sits within the Microsoft ecosystem, and with the reasons that we've touched on previously, it's making sure that you've got the secondary copies that are kept secure so that ultimately you can access it, can get it back when it's needed. You've got visibility to search through the data. The key difference between the shared tenant and local tenant approach is that ultimately with a local tenant, it's going to be the NHS Trust, the organisation that's going to be managing everything within that environment, typically, the users backing up the data that's in there. So that trust, they take responsibility to make sure that the backups are taken. Across the shared tenant, multiple elements of the NHS sharing that, as the name kind of suggests, I suppose. Within that, it becomes a little bit trickier, I suppose, to be able to take a backup copy of the data. And this is one of those things that AvePoint are developing right now, is to be able to take just the data which sits with the specific organization within that shared tenant, without basically compromising access to the data across all the other organizations as well. So it's making sure that only the right people can see the right data to take the backup of it. And AvePoint are unique in developing and ultimately being able to offer that on the shared tenant.
Shyam, anything further to add on that? When
Yeah,
it
I
comes to
think,
shared versus local?
no, this is a great question. I think one of the things is we always talk about the location of the data, the copies, and the integrity of the data, but we also have to think of the production environment. And I think one of the things that's interesting is when you have a isolated tenant, a just from a sheer management perspective, one of the biggest data protection challenges many organizations have is managing multiple solutions, multiple logins, multiple UIs. These things just create more and more opportunity for there to be a misconfiguration in someone's admin access, the loss of a username or password, or people getting lazy to try and be more efficient, and potentially storing their passwords in a non-secure way. So having a single solution that can protect both a centralized tenant and have this sort of multi-tenancy to simultaneously protect other tenants in M365, but kind of giving you that global visibility, I think is very powerful just from a management and operational perspective. But also, we have to think about the segregation of these users and duties. And so, making sure that you have a solution in place that has robust roles-based access control that says these users are help desk for this tenant, these users are help desk globally, this is what they should or should not be able to access. And having a solution in place that's very aware of that, I think is important.
Okay, so let's talk about the threat when it comes to cyber and cyber attacks facing the NHS. It's growing. We've seen, we were all there living through the attack on the NHS around WannaCry, so we all remember that.
Yeah.
But what are the potential threats now to the NHS, and what are the implications, Shyam?
Yeah, I'd say the threats are the same, but evolving, right? So when it comes to something like artificial intelligence, for example, it's not creating necessarily completely brand new threats, but it's modifying and enhancing the bad actor's ability to get better. So they're writing better phishing emails. They're able to generate attacks at a broader scale. We've even seen some very scary ones where they're using deep fakes and things like that to impersonate directors of IT or stakeholders that are allowed to make decisions on security or procurement and things like that. And so I think the risk or the way a breach, which could ultimately lead to a data loss or data exfiltration, is just really changing. And I think that we have to be very vigilant of how the existing threats are, let's call it, modernizing in a way.
David, what are you seeing in terms of the ever changing threats when it comes to cyber on the NHS and its implications? I was only talking to a CIO recently who was saying that we've got to be successful 100% of the time. They
Mm.
they only need to be successful once, so it's all about resiliency. It's all
This is
about
it.
backup.
I suppose it's one of those things where, I mean, I talk to lots of customers, across lots of different industries, and I think within the NHS is probably that one of the few instances where you could say this is a life and death decision to be made about how
Yeah.
you protect your data. Um, Ultimately, I suppose if the doctors, the nurses, the consultants, the amazing healthcare professionals that are out there can't access the right data around their patients, there could be the ultimate knock-on negative impact to them, I suppose. And ultimately, ransomware is the big one that could
Mm.
have the biggest impact, I suppose. Um, Once the ransomware, and it's, as Sham said, sort of AI enhanced ransomware, the threat of that gets into an environment, locks it down, and the healthcare professionals can't see what they need to know about a patient that's having a medical emergency. If they can't make the right decisions on what healthcare to provide because they don't know enough about that patient, the repercussions obviously severe for the patient, severe for the NHS as well, and kind of how do people come to the decision around the healthcare that's being made? So making sure that that data is there, it's accessible, it's protected from ransomware. Um, it's probably the most important place for it to have a backup solution in place that you can recover the data and get access to it again and get visibility of the information to the right people.
Okay, so we've just scared all of our readers.
Yeah,
Let's
sorry
give
about
them
that.
let's give them a bit of hope, and
Yeah.
let's talk about some examples of organisations, healthcare, public sector, wherever, that you're supporting to increase resiliency, and some of the things that they're working on that's making a difference. Shyam.
Yeah, so we're working with a number of organizations. One of the things that is amazing about our solution is because we work with people's collaboration data. It's very vertical agnostic, but we have a lot of expertise in highly regulated industries and across Europe. For example, we work with a Dutch training hospital, Franciscus Gathius. I'm probably butchering the name. I apologize, but they have over 4,900 employees, among which 340 are doctors, 120 are volunteers, and so you've got patient information, you've got segregation of duties, you've got very very important research that's going on. We also work with folks that have very strict data sovereignty needs. So we work with a German cancer research institute as well. And one of the things that's really important is most of these organizations just need peace of mind that, hey, I've got data sitting here. When I move it from a legacy system or another workload, is my backup solution cognizant of this? Is it going to automatically enable protection? When a healthcare worker joins or leaves the organization, are we responsibly backing up that data? And also, is my data protection, and this is why I think data resilience is the new term, and it's really important, is keeping a copy of that data is great, but knowing how many copies, how long to hold on to it, when it needs to be deleted, what storage it needs to reside on, and so much more becomes really, really important. And this is what a lot of these organizations, are relying on us to provide them.
David, from a Bytes perspective, public sector is such a important vertical to your organisation.
That's it.
Where are you supporting it at the moment to improve resilience? Any examples that you can talk us through?
So in terms of, I suppose, specific examples, I'm not sure if there's any uh, organization names that I can share in public, but we do touch on, I suppose, every customer within public sector. Public sector makes up about a third of the overall Bytes business, and that is covering everything from healthcare, the NHS, universities, local government, central governments, even MOD as well in a slightly more specialist area of
Mm.
the business. Um, we often see that if we took universities, for example, and it's sort of building on the point that Shyam was making there around data retention, certainly in universities and education, there'll be not just the people who work in the organizations, the teachers, the tutors, and the admin staff there, but there's also the students who sit within there who are creating information
Mm.
within the wonderful tool set that Microsoft provide. Once those students have moved on to the next level of education or out into the great wide world of work, there's then that question of, well, do you want to keep hold of their data any longer or not? And so it's important to have the tools just to make sure that you have that visibility of the data, not just for restoring it when the students are there, but also to have the visibility and the understanding of it so that you're not just keeping hold of it for no purpose whatsoever and just
Yeah.
Just increasing your Azure or AWS spend year on year. Is that what you're saying?
Exactly that. Yeah. Nobody wants to be paying for something that you don't really need to. And let's face it, we all know that the data volumes out there are growing exponentially. As humans, we're all hoarders. We keep hold of things. So when was the last time you went through your files and deleted out anything that you're not using anymore? We keep hold of
Yeah.
it. We don't tidy it up. So actually putting in that degree of automation behind the scenes is really important from, I suppose, ease of management, but also very much the cost saving element as well. And let's face it,
Yeah.
within public sector, budgets are always being stretched. Every penny's being looked at really. So putting in the
Do you
right
find
solution that helps that is so
do you
key.
find there's, I suppose, more of an appetite to have that data resiliency strategy and focus if your data's more sensitive?
I think so. Yeah, we get those demands, and ultimately organisations are having people like chief compliance officers
Hmm.
who need to understand the data, and they need to make sure that the rules, the decisions they're making around retention, understanding the data, are implemented by the IT teams. So that's where ultimately we're having those conversations. We've got the technical expertise behind the scenes as well to kind of scope out and create that perfect solution, really, in terms of the tools that are implemented.
Yeah, and if I could add one thing, that chief compliance officer kind of has a new friend that's starting to pop up in the organizations. The chief data officer, or someone, or a group of people who have the shared responsibilities of that role, and that really starts to deal with that problem you brought up there, which is cost and understanding. You know, do I need to hang on to this data because it has research value, because it has historical value that can, improve patient care and outcomes? Do I have to hang on to this because of compliance reasons, or, is this high risk data and should I actually get rid of it? Right? So this challenge of data growth does become a data protection challenge as well, because the more data I have, the harder it is to meet my backup windows and take backups within the RPO and RTO that I want. And it's going to increase that bill, like you said. And so, one of the things that really sets us apart from other vendors, and why we tell that resilience story, is we're identifying the content, we're tagging it, we're letting you know whether it's sensitive, high risk, low risk, how many versions are there. And then you can have that sophisticated discussion on what do we need to protect, what do we need to delete, what do we need to archive, and then how do we enforce our go forward policies. So we're not just spending, a bunch of money on blob storage that's adding no value to the organization. We'd much rather you spend your money on research, using AI, using other more advanced workloads in Microsoft 365, and not looking at a storage bill. And our resilience story doesn't just expand to backup copies, and that's where most backup vendors' story ends. But we're looking at your production data as well.
So, one of the final things I wanted to focus on,
Yeah.
I'm conscious of time, which we've talked about that chief compliance officer now having a new friend. I think they did probably struggle making friends in that role, in all
Yes.
honesty. But given the sensitive nature of healthcare data, what measures need to be in place to make sure that NHS organisations are, fully up to speed, fully compliant with regulations, Shyam?
Yeah, it comes down to having that trusted partner that has all those badges. A lot of times on the marketing side, we like to put badges on her website for what certifications we have. But at the end of the day, they really mean something. When you have your ISO, when you have your SOC 2, when you're meeting the strict requirements for things like FedRAMP, when you've got 14 data centers around the world, you're supporting multi-geo and things like that. Um, this is what people need, because they don't want to think about where their data is stored, whether or not their backups are immutable, whether they're encrypted or not. What happens if a ransomware attack, hits their system? One of the nasty things about ransomware is these guys have figured out we should attack the backups. Sometimes they'll attack and encrypt the backups if they're on the same network. Sometimes they'll actually use a different type of maybe user compromise or admin compromise attack, log into the backup interface, use legitimate tools and operations to just blow away the backups, and then have the ransomware attack actually take hold of the critical data. So having those copies in place, I think, is very important. Knowing who is storing your data, but also knowing what recovery looks like. A lot of legacy vendors did a really good job of protecting files, folders, your operating system, your endpoints, and things like that. But they don't quite do app aware recovery. We have so much more data in M365. It's in Dynamics, it's in Planner, it could be in Viva. And so it's starting to go through all of these different systems. And I think a lot of people are missing their actual, uh, the risk or the visibility of the data that they have versus what they don't have. I'd say that's a big consideration right now.
And David, in terms of Bytes' NHS customers, what measures need to be in place to make
Yeah,
sure that they're fully compliant? And is it that that's driving their engagement with Bytes and with AvePoint? Is it the risk, or is it the compliance with the regulations?
it's a bit of both, really. I mean, we always traditionally said that across a data management strategy, that you talk about your backup, your disaster recovery, your business continuity as your must-have element, and then you look into more, I suppose, of data insights, data governance, user governance controls as a should-have. Those elements are increasingly becoming the must-haves. And certainly when we're talking about healthcare, you need to understand what the data is, if it's that sensitive data about patients, and ensuring that only the right people have access to that data. It needs to be the doctors, the nurses, the consultants. It needs to not be the cleaning team, for example, who can see a patient record or anything like that. And when you start to look into those controls, I suppose you could look at it as just a one-off exercise to do that, but what you've got right on day one isn't going to be right on day two. Something will have changed. Somebody's changed roles. The data's been changed. So actually having the automation in place that looks into the data, understands what it is, and then applies the controls that are needed to lock down access, lock down the users. That's becoming increasingly critical because, as I've said, the tools that Microsoft have provided within the Microsoft 365 estate, they're fantastic when it comes to generating new information, sharing it with your colleagues or external consultants, even collaborating. But once, let's say, an external consultant isn't working on a project anymore, then should they still have access to the data? No, you want to be alerted to that straight away, especially if that's an external healthcare professional that's come in.
Yeah, and one thing I'd add there on the context of what Microsoft has built, let's say you get all of your security in place, everything is locked in solid, and a healthcare worker needs to be able to restore or recover a record. Does it make more sense for them to be able to navigate and see only the data they have access to and perform a self-service recovery, A, reducing that IT overhead, but B, also avoiding that help desk admin needing to have elevated access to that data to visually verify it and stuff like that, when at the end of the day, it's that doctor or patient or whoever has the right context is going to verify the data is accurate anyway, right? And so delegation and these little things might not be something you think of up front, but might have surprising benefits, later on in the field and in action itself.
What a great way to finish off our podcast. I'm going to say thank you very much to my two guests, David Leech and Shyam Oza, for talking to me today. I'm sure our listeners have found the information you've shared very insightful. I'm Mark Blanchard of GovNews, and thanks for listening to this talk on how third-party backup can accelerate recovery. Thank you for joining us.
Thanks,
Thank you.
everyone.